welcome. STL, we are the home of the technology superheroes, as you can see there, right? So specifically, we're going to focus on Super Nurse today because this is a healthcare related discussion. Our diploma, as we like to call it, right, talks a little bit about who we are as a company. Been in business 32 years, obviously 24/7 operation, as our hospital customers are as well. We have lots of different certifications from multiple vendors, both on the also healthcare side, IT side, voice side. Have support well over 50,000 customers. You can put all of our employees together. We have well over 1,000 years of industry experience, and we are SOC 2 certified. High level of all the different things. Jim, you're probably aware of a lot of this because we've talked about some of these and we've provided some of these for you. But we really have 4 different areas. Obviously, the healthcare solutions, which we're going to dig into a little deeper today. Voice solutions, which I know is on your radar at some point, and we'd like to finish that conversation whenever the timing is right. Data and IT solutions, right? So we put your infrastructure in, and we're having some discussions about enhancing that for you. So you're familiar with a good amount of that. And then really networking and bandwidth are kind of the drag along things, right? Whether it be SIP trunking for a customer with a phone system, whether it be internet bandwidth, or if they want to do some resiliency, some SD-WAN. So those are the quick highlights. This is our 4-quadrant document that we share with our new prospects and customers. So digging a little deeper into what STL can provide healthcare customers are obviously managed service nurse call, which we refer to as total nurse call. I know, Jim, that's been part of our conversations in the past. We focus on, nurse call for acute care facilities, our hospital customers. We spend a lot less time on senior living, but we do have the ability to do some senior living as well. Telehealth. Otherwise, now we're kind of changing the name of that to be virtual care. But yes, we can do that where patients can interact with either care providers and or family members more easily. Clinical mobility solutions, right? Everything from handsets, voice handsets that allow the care providers to communicate wherever they are within the facility with their staff, things along those lines. Emergency call kits, we just deployed that for one of our customers. We had an emergency wireless kit that they needed a solution. They needed it the next day, and Scott delivered it to the customer, and they couldn't have been happier about that. So emergency mass notification. That can take many forms, but one of the popular forms would be communicating with large groups of people when something less than ideal is taking place. So we have solutions that allow that within a healthcare environment. Prescription refill, kind of a self-service discussion. That's a really specific example for healthcare that we have done for a few of our customers. And we'd be happy to have that conversation of what the benefits of those things could be, if that would be of help. RTLS, real-time location. Certainly within a healthcare environment, that's a popular discussion because at the very highest of level, it allows more granularity in the nurse call reporting. So not only does it say that someone came into a room at such and such time, it tells you specifically who, right? So there's all kinds of detail there that's benefit. And then, we can offer, either cloud, premise, or hybrid offerings in many of these solutions. Do you have any questions about any of that?
No, I don't think so.
Okay. Obviously, total nurse call we've talked about, that's focused on critical access hospitals, 25 beds or less. It's a way of, and I think you're familiar with this, it's a way of purchasing a nurse call solution as a complete service. It includes installation, training, all the associated hardware and software. This example assumes that the monthly expense is $3,611. It also assumes that the facility that we're talking about has a payer of 70%. And then there are the numbers that were shown, are relatively, you're effectively only paying 30% of the monthly fee, right? These are the benefits of total nurse call, right? So, and again, if we get back to that point of that discussion, we can have that specifically for you, Jim. So that's my handoff. The next step is Chris is going to take the reins and talk specifically around the HCAHP scores and what the Westcom solution can do to improve those for your organization. Chris?
Yeah, thanks, Dave. And I know I've introduced myself briefly, but I'll go ahead again. I'm Chris Harrison. I'm the Regional Sales Director for the Midwest with Westcom Nurse Call Systems. I get to work with STL and a number of other distributors in the Midwest to implement nurse call systems and really improve communication and patient satisfaction through nurse call as a central communication platform. A little bit about Westcom. We do have purpose-built solutions for all three facility types, from community care, as Dave mentioned, to acute care, and even post-acute care. So we have purpose-built devices that can all work together or independent of each other, depending on which type of unit you're in or what type of facility you are. A little bit about our background is we are a privately held company based in Northern California. We've been around since 1983, and we truly are built through innovation. Everything we're going to talk today about, especially the advanced features, are direct results of working with healthcare facilities for the past almost 40 years and having boots on the ground and trying to solve problems that they run into. Being based in the U.S. And manufactured in the U.S. Means that we have a lot more control over our supply chain. And I think in today's world, it's been proven that is a major benefit in the fact that we are still able to ship product and service facilities because we're made and based in the U.S. So today we're going to talk about HCAHPS scores, and a lot of these initiatives that you see here are very common initiatives, and really they all kind of relate back to HCAHPS scores and patient satisfaction overall. And I think that big one in the middle is kind of the most important one, is communication. And I think that touches every single one of these. So what is an HCAHPS score? Well, HCAHPS scores are surveys that are sent out to patients after they've been discharged. I've gotten these surveys after a couple shoulder surgeries I've had, and I like to relate it to almost like when you take your car to the dealership for service, you'll get a satisfaction survey, and it's usually a 1 through 5 or a 1 through 10 scale, and it has a direct impact on your funding and reimbursements that your facility gets based on patient satisfaction. Here are some examples of actual questions from the HCAHPS survey. How often did you get help in getting to the bathroom or in using a bedpan as soon as you wanted? During this hospital stay, how often did nurses treat you with courtesy and respect? What language do you mainly speak at home? During this hospital stay, after you pressed the call button, how often did you get help as soon as you wanted it? And we truly, if we take a look at these questions, I think they all point back to communication in just that the feel of the patient and the feel of the service that they feel they're getting and quality of care that they're getting. So if we dive into just one of the innovations, it's been around forever and all of our competitors have it now, but we were the first ones to implement this, is this direct pain medicine and bathroom requests. So when we have some integrations with mobile devices, as Dave mentioned, we can actually send those calls to the correct staff members directly, so they know exactly what the patient is calling for. And we can bypass the RN, for example, for a bathroom assist and go directly to the tech or the CNA and speed up that response time by not having to filter through who is actually going to take care of this patient in their particular need at that time. That's a really small example, but it's had a huge impact on patient care over the years. Our workflow stations, and Jim, I'm not sure if you're familiar with our workflow stations, but these are a touchscreen device that we typically put on the outside of the room. These touch just about every initiative that you can think of, and we can custom design these for your facility. As it relates to bathroom or assistance there, we can simply put a bathroom timer on there. Alternatively, you can kind of see that there's pane timers, turn timers, chair timers. We can actually use this for digital signage on the outside of the room as well, which can really help limit and speed up the service on when we can show what PPE needs to be entered, and you can quickly identify what the status of that patient on the inside is. And then we can also speed up our communication with our patients in service of them by sending direct requests directly to mobile devices. So if we need to clean the restroom after an incident, we can send a direct request to EVS, for example, to clean bathroom in room 330. No need to go track them down by phone, get the call sheet out, figure out what extension to call. We can just send it right there, and it's been proven to have turnover greatly improved. Here's an example of the main screen when you would interact with the workflow station. On this particular one, we've got timers. We've got provider in room, so we can quickly see that, and we can actually report on all of this as well. We've got requests that we can send to other departments, and then specifically EVS. And then some of the timers we have on this one are pane, turn, chair, bathroom, feeding. And this really, for example, when we administer pain medications, this lineates the process to go check on that patient again once we've administered pain medicine. Because in a typical clinical workflow, I could imagine that 30 or 60 minutes can go by in the snap of a finger when things start happening on the unit, and then you can just simply forget to go back and check on that patient to turn them or to do a pain reassessment. And this can take that process out of it, send the notification directly to the mobile device, can be reported on, and streamline the process there without trying to rely on memory. And then here's an example of some of the different departments that we can send requests to, various requests through mobile devices. Our patient care board is an offering we have, and it's a digital whiteboard, and I think it's very easy to see the correlation between this and certain patient satisfaction metrics that are going to be questioned on. One of this is during this hospital stay, after you press the call button, how often did you get help as soon as you wanted it? Well, a lot of patients, myself included, when you're in pain or you're needing something, 30 seconds can feel like an hour, and 2 minutes can feel like 2 hours. And your response times could be right where they need to be. But perception is reality oftentimes. And so what we've done is we've developed this patient care board that has this call assurance message that pops up on the screen. And what we've seen and noticed is that actually reduces the anxiety level of patients and makes their perception of better and more prompt care. And then the question of what language do you mainly speak at home? When we have that integration with the EMR, one of the questions or drop-down boxes on admittance is spoken language. And so all of these messages can pop up automatically in their spoken language. And again, that reduces their anxiety, and it elevates their sense of care that they're getting, and really puts that perception to reality into play, and makes them have a more positive experience overall. Here's an example of a patient care board in a typical room layout. This does replace the whiteboard in the room, the dry erase board. All of these care blocks that you see on there, from providers, daily plan, activity, all of that is fully customizable for your facility, and it can be automatically populated directly from the EMR. So take away the manual process of charting and then also updating the whiteboard, and leverage the technology that you're already using by your EMR, and automatically populate that care board. And what we found is that having ready and accurate access to that information, it reduces call volume with patients. It lets them know what's going on in their care plan, and it actually reduces risk and mistakes. The facilities I've worked with that have implemented this, it's almost an immediate reaction that there's less mistakes made from either the nurse walking in at shift change and seeing what's going on with the patient, or maybe dietary when we have the icons on the top left that you can see on that care board. Maybe we have NPO, or we have certain dietary restrictions in the care block. And when we have family members visiting patients, they can see and be part of that as well. And it can all lead to reduced calls and higher patient satisfaction. Here's an example of the call assurance that pops up when the patient pushes the button. I think this is also a unique piece because back in the 80s, when electronic nurse calls were really starting to take off and change and develop, one of the biggest complaints with patients was just how loud their facility was. Everything's beeping. There's so much commotion and hustle and bustle going on. And since then, there's been a lot of emphasis on making these systems as quiet as possible. So when you push that button, you just simply don't know that it went anywhere. I like to think of it like when you're standing at a crosswalk and you push the button, and it may only take a minute for that light to change, but you have no idea. So you end up pushing the button over and over and over again, and you get kind of irritated with it at times. At least I do. When we have an integration with an RTLS system, as Dave was mentioning, we can actually identify the nurse or staff member that just walked into the room. And that also improves the patient satisfaction, reduces their anxiety. You get maybe an elderly patient, and in this example, Ronnie Allen is going to get to know Heather and Diane pretty well. They're those direct care providers there. But if I was to walk in, bearded guy with a mask in my room, they have no idea who I am. So we can really put their mind at ease by doing that. And then keep in mind with that RTLS integration, we're also reporting on that. So we can get metrics and data on how much time is spent with patients. If we have a commit to sit initiative, for example, we can make all of the policy changes that we want, but without the data to back it up, how do we know that we're making progress on these initiatives that we're working on? We can reduce your fall risk and provide direct notifications when we have, for example, a bed alarm hooked up through the nurse call system. And then with the patient care board, we can actually display that message and create an audible tone. And I always like to joke and say I think we need to get Samuel Jackson to do the narration for the get back in bed. But here's a message that can pop up, for example, if the patient does exit their bed. And then here's that example if they were Spanish speakers, and we can do that in their spoken language, and populate that right on the care board. Here are some different templates. Every unit is different in a facility and what they need to show their patients and what they want to show their patients, and what their care is. So we can provide templates for each unit in your facility. They don't all have to be the same template. And in that regard, the templates can be updated as time changes, because the one thing we know, the one constant we know, especially in healthcare, but in life in general, is the only constant is change. So we're always able to work with your facility and make sure we have the correct information that you want at that given time on your patient care board. And so why would we invest in electronic whiteboards or patient care boards? What's the financial ROI, and what are we getting for staff and patient satisfaction? Well, Guadalupe Regional Medical Center is a very large facility in Texas that we work with, and they've been a longtime customer of ours, and they have reporting from before and after the implementation of the patient care boards in their facility. And what we found was just in the first month, by implementing these patient care boards, we were able to reduce their call volume by 32%. And now that for that particular facility was a reduction of 800 calls in one unit in 1 month. And the CNO there will attribute that directly to providing access to the information in real time. And we reduce the need to call and ask what's going on, and reduce their anxiety and raise their patient satisfaction. When we talk about 800 calls or 15 calls, depending on your call load at your facility. That puts a lot of time back in your nurses' days to focus on the important calls and to have that face-to-face interaction with patients, and which also has a direct impact on your patient, your HCAHPS surveys, because the patient satisfaction just goes through the roof. We also have a virtual care component that we can add with the patient care board. When we first came out with this, we did call it telehealth, and I think that painted it into a corner. When I think of telehealth, I think of a cart that you wheel into the room, and it's used for kind of very specific purposes. We've since updated this to virtual care, because you get all of the basic telehealth components of bringing in specialists and doctors that are on or off site with patients, but we can also provide access to family members. We can allow virtual sitting. We can allow virtual rounding from nurses. Let's say we're in an isolation patient, we can pop in and talk to them face to face without donning our PPE, so we can reduce costs there as well. And then we can bring up to 4 people onto a call at any given time, including family members, nurses, and other providers. So we can really, as we have family members and caregivers spread across a region or the country, we can still allow them access to the care plan for these patients upon discharge. It is full screen, so typically on a patient care board, I like to see about a 42-inch monitor in most patient rooms. So the patient's going to have a good view of whoever they're speaking with. What we do is all we have to do really is put in a 360-degree zoom camera and then a speaker microphone and the software to drive it. And then we're able to initiate virtual care and virtual visits from family members. Here's an example of what it looks like on the patient's side. When somebody is accessing the patient through the virtual care platform, the screen will pop up with a code, so they have to be invited in. I think that's important to note for privacy issues, because you can't just drop in at any given time. Obviously, that doesn't apply to virtual sitting, as the camera would be on them at all times. But the patient would need to invite somebody into the room. Here's an example of what it would look like on a mobile device. You'd ask the patient what the code is, enter that, and then you're live with the patient on a mobile device or any device with internet and a camera and microphone. You can visit with the patient there. And then once the call is ended, it goes right back to that template so that the patient is still in the know of what their care plan is. We also have a mobile care application that is relatively new with Westcom, and really the intent of this application is to give you a more robust use of your mobile devices if you have smart devices. So without the mobile care application, we can still send our text notifications and provide audio callback with any mobile device on the market, whether it's SpectraLink, ASCOM, Vocera, whatever that may be. However, if we have smartphones in the mobile care application, we really give you the ability to do everything from your mobile device that you can do from a nurse console, as far as forwarding messages and communicating with your care team, and seeing the alerts that are there. So here's an example of this particular nurse has 2 alerts on her phone right now. And I love on this example that it's going to go to the routine before the staff emergency, but it puts them in timestamp order. And then here's an example of in the mobile care app, how you can interact with that routine call. We can do an audio callback by clicking the phone button. We can initiate a virtual call directly with the virtual care and drop in and see that patient right from the app. We do have a history of the calls with that patient that display right on the screen for you. And then if we're tied up and we talked with the patient and they just need an extra pillow, but we're tied up right now, we can keep that and it's going to go back on this front page so that it's still there for you. So it's a good reminder there. Or this is an urgent need and we're tied up in PPE in an isolation room. So we can go ahead and escalate that and send it directly to our care staff that our support team that we've set up without having to call them or anything. They're just going to forward the call right on to them. we can see who our other staff members are assigned to and what staff members are assigned to what room. And from here, we can actually call them directly. There's no need to exit the app and go into a separate dialer. You just click their name and make the call. And as you are aware as a Westcom customer, but Westcom always provides a path to upgrade. So your current system has been installed for about 15 years, you guessed. So everything that we've talked about today, and there's a lot more that we can talk about, can still be added to your system without a full rip and replace. We do always provide that path to upgrade. All of your Westcom manufactured products come with a 5-year warranty. They're made right here in the United States, between California and Arizona. And then we don't have any ongoing licensing fees, which I think really differentiates us from our competition in the nurse call world, where once you purchase a Westcom system, you own the Westcom system, and we don't send you letters saying we're going to go end of life. And we also don't send you licensing fees every 1, 2, or 3 years to keep the system online.